fruit, and milk also has a sugar in it called lactose. So our bodies break down these foods, and what ends up in our blood is glucose. And as Dr Qureshi described before, insulin is a key that opens up the door of the cell to allow the glucose to go in so that our bodies can have energy and work properly, and that our brains can work properly. So just to recap, really important, carbohydrate must be a part of each meal when you're injecting. Okay. The next thing I wanted to just run through is hypoglycemia. Now, Parminder, the nurse, would have talked about what that is, but just as a recap, hypoglycemia is when your blood glucose level goes too low, and generally that's below 4 millimoles. Some of the symptoms, again, as a recap, you would be shaky, maybe some tingling, sweaty, a bit of confusion, maybe a headache, could have blurred vision, and maybe a little bit unsteady, or even just feeling very hungry. What we need to do to prevent a hypo, which is actually the most important thing, is to prevent it, is to make sure that you have carbohydrate at each meal, you have regular meals and don't miss meals, eat more carbohydrate if you think you're going to be more active or you're doing some exercise after the meal. And also, very importantly, if you're drinking alcohol. Now, alcohol can stop glucose being released from the liver, so it's really important that if you are drinking, you drink when you've eaten something, so not on an empty stomach. And if you do drink too much, make sure that before you go to bed you're having some kind of carbohydrate snack. You know, toast before you go to bed is always a good idea. So that's really important. Now, if you do have a hypo, you need to make sure that you are giving yourself very quick-acting sugar. And the best way to do that is to either have a small glass of Lucozade, not the whole bottle, because that's just going to over-treat your hypo. A small amount of Lucozade, a small cup, or 2 or 3 Lucozade or glucose tablets. Now, you can get those at the pharmacy, and I always recommend that people keep those with them at all times, just in your pocket, easy to keep with you. Once you've taken the short-acting glucose, it's always a good idea, once your glucose level, when you prick your finger, is above 4, is to have something more starchy, because that keeps your levels above 4. So maybe a slice of toast, or if your meal's coming up, your meal would be a good idea to have them. Okay. So that's hypo. It's really important information. You can always come back to this again in the DVD. The one thing you need to stop having, however, are sugary drinks, you know, your Cokes and Fantas and those kind of drinks, unless you're treating a hypo. And also, if you normally add sugar to your tea and coffee, stop. Have something alternative. There are lots of alternatives to sugar out there at the moment, and you need to be adding that. On a positive note, you know, it's not about a zero sugar diet anymore, diabetes. You're injecting insulin, and what we're going to teach you in the carbohydrate counting course that you'll come on in a few weeks or months' time is how to adjust your insulin to what you eat. So therefore you should have a really great amount of dietary freedom, actually, besides the sugary drinks I was talking about earlier. So, you know, thinking about it from here onwards now, in the next few months you should learn how to manage your diabetes and eat what you want, when you want, but just adjust your insulin accordingly, and we're going to help teach.
Hello, I'm David Cahill from the Diabetes UK Hounslow Voluntary Group. There are 2 voluntary groups really supporting patients from West Middlesex Hospital. One's based in Hounslow, one's based in Twickenham, the Richmond and Twickenham group. The main services that we offer to patients is to hold meetings primarily on a monthly basis where we have talks from healthcare professionals, namely hospital consultants, university lecturers, people like dietitians, where they come along and talk about diabetes. They talk about what it is, recent developments in cures, what the diabetic complications are. For example, from having diabetes, you're at increased risk of going on to develop heart disease, an eye problem called retinopathy, having a stroke, having neuropathy, and how, most importantly, how to reduce the risk of going on to develop these conditions. The main way of preventing developing these conditions is to improve your healthy lifestyle, and primarily that's done through self-management and the way we manage the condition. I'm lost completely now. By coming along to these meetings, it's a good opportunity to meet other people with diabetes and to be able to ask them questions like, what have you found that works? What sort of diet do you use? Have you found that eating certain foods pushes up your sugars, and what's the solution? So it's a good way to share good practice and good methods of improving healthcare that doesn't necessarily come from a healthcare professional, but from other people with diabetes where we know things work. Hounslow has 11 meetings a year, and they meet at Montague Hall in Hounslow, just off the High Street. The Richmond group meets at St Mary's Church Hall in Church Street, again just off their High Street. There's also a children's Diabetes UK group run by the Richmond Twickenham group. They're primarily aimed at parents whose children have type 1 diabetes, and for the children to come along. They don't necessarily have talks, but they offer more one-to-one type contact with the families, and I'm sure you'd be more than welcome to come along to them. There's details later on how to contact all the groups and to get hold and to when to come to the meetings. There's also a Diabetes UK desk here in the hospital in the atrium. It's open on a Tuesday morning, it's run by volunteers. You can come along, get free information and booklets and leaflets on diabetes. They've got textbooks and reference books from Diabetes UK that you can buy. You can find out more details about when the meetings are, and you can also find out about local courses that are available in the area. There's also help available from Diabetes UK nationally. You can ring them, you can join as a member, or you can just ask for help. The sort of help that they will provide is providing information packs to newly diagnosed diabetic patients. They have the booklets and leaflets, they have the books that you can buy, the reference books. They operate a care line where you can ring in for confidential information and advice. And there's also a relatively newly set up team that looks specifically at patients with type 1 diabetes, and you can get through to have help from them. By getting the annual membership with Diabetes UK, you qualify for the Balance magazine, which is sent out bi-monthly, and that's a really good source for new information about diabetes. When it comes out, it's hot off the press, so to speak, long before it might reach a book or a leaflet, and then you can be really up to date with developments of diabetes and the sort of help you perhaps might be wanting to ask your doctor for that you might not otherwise know about. They have a very comprehensive website with an extensive range of information on research, help, advice, and for example weekends away, which are organised for diabetes people or families trying to adjust and manage their diabetes better on a day-to-day basis. The last area I'd like to talk about are the courses that are run locally by the NHS and the provider services arm. They're not necessarily the same courses available for Hounslow as Richmond Twickenham people, but nevertheless you should ask to see if you're eligible and be able to get on the courses. There are Daphne courses and Desmond courses aimed at people with type 1 diabetes who need to manage the insulin, or generally for type 2 diabetes patients. There's an expert diabetes course, and this is aimed to enable adults with type 2 diabetes to increase their self-management skills and knowledge and confidence in managing diabetes. There's ARPKA SEAT, ARPKA Hearth courses, which are aimed at Punjabi and Hindi speaking adults with type 2 diabetes to enable them to increase their self-management. It's similar to the expert diabetes course, but obviously for Hindi and Punjabi speaking people. There's a Way to Lose course, which is aimed to enable patients to lose weight and change their eating habits to eat more healthily. There's an Expert Patient Programme course, which is aimed to enable patients with long-term chronic conditions similar to diabetes, or indeed with diabetes, to better self-manage their condition. There's an exercise on prescription course which is aimed to teach you how to use gym equipment and to exercise regularly and correctly. There's a lifestyle management course aimed to improve your health not only physically but also psychologically and socially. And a cardiac rehab stage course. Although designed specifically for cardiac patients, it's also available for people with diabetes to aim to aid recovery from cardiovascular disease and help to return to a normal lifestyle.